We all love the freedom a restful sleep can give us, don't we? And that's why we love our CPAP machines. They give us a good night's sleep, and a good night's sleep makes our day so much better. No, you had me at beep. But that doesn't mean the relationship is perfect. Yes, CPAP therapy gives us uninterrupted sleep, but it can also give us other things which are not quite so, well, ideal. I'm talking about those unwelcome side effects we sometimes get that we really wish would stop, but no matter how hard we try to change, it's just never good enough and, well, anyway. This video takes an honest look at the less pleasant side of your CPAP relationship and what you can do about it to improve things. Just keep it between us and don't tell BP, okay? Thanks. What? Oh, no, nothing. I was just telling these wonderful people how good you are. Well, hi, I'm Ruben from Respshop.com, your favorite online supplier for all your CPAP therapy wants and needs. And today, we're going to do a deep dive into some of the more common side effects of CPAP therapy. Now, these include shortness of breath, aerophagia, dry airways, dry or sore eyes, and claustrophobia. I'll be explaining what each of these is, what causes them, and how you can try and eliminate or at least reduce them so you can keep your CPAP relationship sweet. And talking of wonderful relationships, why not hit that like and subscribe buttons so we can keep our top-notch CPAP info relationship going too. Okay, enough with the romance metaphors because we're about to get scientific. Here goes. So first up, shortness of breath. This is caused by the difficulties we can all experience in breathing out against the air pressure in our masks. Even though the mask has sufficient air getting to it from the CPAP machine, if you can't expel enough air during your exhalation, you won't be able to breathe enough air back in, and that makes you feel short of breath. Now, the best thing to do if you are experiencing this symptom is to find ways of reducing the air pressure you have to fight against when breathing out. This could be done by turning on or increasing the device's pressure relief setting if it has one. This feature is available on certain auto and manual CPAP units and decreases the air pressure on exhalations only, and typically has options to select for how much the pressure will decrease. If you are using a manual CPAP machine without an exhalation pressure relief function, this would mean you would need to reduce the overall air pressure coming into your mask. In either case, you should only alter pressure settings on your machine after consulting with your doctor or a sleep therapist. A good way to know if the pressure is in a good range is to keep track of your apnea-hypopnea index, or AHI for short. As long as the AHI remains low when the pressure is reduced, say under 5 or so, then that's often a good sign that the lower air pressure is helping to make breathing out that bit easier. You might also consider switching to an automatic CPAP machine, also known as an APAP machine. These devices have algorithms that adjust the air pressure according to the sleep data it records from you. This clever computer program tracks your sleep patterns during the night and makes changes to the airflow, making sure you have the pressure you need during sleep, but only the pressure you need and not more. And then there are BiPAP machines, which allow the air pressure to vary between inhalation and exhalation. These units detect when you are breathing out and reduce the air pressure to make exhalation easier, and then increase the air pressure again when you breathe in, which is precisely when you need it to keep your airway open. Without that high pressure making it difficult for your lungs to push the air out, you should find that the shortness of breath problems disappears. And if not, consult with your doctor to ensure the inhalation and exhalation pressure settings are optimum for your needs. Next up, aerophagia. Aerophagia is a fancy name for a condition where the air goes down into your stomach and intestines instead of your lungs and becomes trapped. All that trapped air can make you feel bloated and give you stomach aches, heartburn, and/or acid reflux, along with making you burp and do other unpleasant things related to trapped gas in your digestive system, whatever that might be. As with shortness of breath, the solution to this problem often lies with adjustments to your air pressure. If the air pressure is set too high, it can become too much for your lungs to take in, and the excess air may force its way down into your stomach instead. In this case, as with the solution to shortness of breath, try to find ways to lower your pressure by using your AHI data as a guide to finding the sweet spot. Maybe consider switching to a machine that modulates your pressure to keep it from being too excessive, such as an APAP or a BiPAP. And if you are already using a machine like this, you can increase the exhalation pressure relief they offer to give you that extra bit of comfort when breathing out, which should help too. But it's not just high pressure that can be a problem. Aerophagia can also be caused by air pressure being too low. If the air pressure is insufficient to keep your airway open, you will experience more obstructive events which can cause you to gasp. When that happens, you can end up swallowing air, which then gets trapped in your digestive tract, and the result is the same. So either way, try to make sure you get that air pressure just right, and you could notice a big difference. Another reason for aerophagia can be related to mouth breathing. Mouth breathing occurs when you breathe in through your mouth instead of your nose. Sometimes this happens as a result of temporary conditions such as congestion in your nose or sinuses, but it can also become habitual. Either way, it is known that mouth breathing can contribute to aerophagia, and so it's best avoided if you can. Congestion should clear up on its own, but if you find mouth breathing is habitual, and if you are using a nasal mask, it can be worthwhile switching to a full face mask, as this can help you avoid mouth breathing. Aside from that, there are other ways to train yourself away from mouth breathing, such as getting some mouth tape or chin straps. Mouth tape keeps your mouth closed while you sleep, and chin straps hold your jaw closed to train you away from mouth breathing too. If you can prevent yourself from mouth breathing, you can often reduce or prevent aerophagia symptoms. Now, another cause of aerophagia can be your sleeping positions, especially if you tend to sleep on your back. The way to test this is to adjust your sleeping position to an incline between 30 and 40 degrees and note what changes this makes. Number 3. Dry airways. Getting a dry mouth, nose, and throat is a very common side effect of CPAP therapy. All that air pressure can dry out your upper airways pretty quickly. And not only is having a bone-dry mouth an unpleasant way to wake up, it means acid and plaque don't get flushed away from your teeth by your saliva, which can have other nasty effects such as bad breath, a higher risk of tooth decay, and increased teeth staining. And as a tea-drinking Englishman, I know all about stained teeth, so consider me an expert here. And some of the solutions for dryness we've already covered. Once again, keeping air pressure as low as possible and making sure you don't mouth breathe can have a big positive impact on dry symptoms. Makes sense. Less high pressure air rushing through your airways means less of the thing that causes it to dry out. And your nose is a natural humidifier, adding moisture and warmth to the air that passes through it. So breathing through your mouth instead of your nose means less warmth and moisture in your breathing, and so more dryness by the time you wake up in the morning. It's the same solutions to these problems we've already discussed, like reducing your air pressure and changing up your unit or your mask. But increasing the warmth and humidity of the air coming from your unit can also help a lot with combating these side effects. Make sure you get a good humidifier and add a heating tube for your machine too if it has this option. Then adjust the heating and humidity levels to get them at that optimal point for you. And if you want a bit more warmth, here's a hot tip. Tip hot water into your humidifier instead of cold. Well, warm water actually, otherwise you might scald yourself if it's too hot. But if I'd said, here's a warm tip, the pun wouldn't have worked so well. But you get the idea. Preheat your humidifier water to slightly warmer than room temperature and it could help. That's my hot tip. Now moving on from dry airways to dry and sore eyes. The cause of this is air leaking from your mask during sleep and drying out the natural fluid that keeps your eyes moist, which can then make them sore. The solution is, obviously, to prevent mask leaks, and there are a few things you can do about those. One is to make sure your mask is on tightly enough. Sometimes users adjust their mask straps while the CPAP machine is set to be at low pressure before ramping up. Now this can mean the mask is not made tight enough to deal with the increased pressure when it comes, and air leaks out during the night. Now to stop this, make sure the pressure is at the full sleep level when you adjust your mask tightness so that you can be sure the extra pressure won't cause problems later on. Often this can be done by using the unit's mask seal testing function, which tests the mask seal against a variety of pressures. Another cause of mask leaks can be the mask is not sealing properly to your face. Often this is because oils on the seal prevent firm contact, which can then mean air leaks out. So make sure you give your face, the mask, especially its seal, a good clean before bedtime and replace the seal at the rate recommended by the manufacturer. Mask liners can also help here too. These are cloth liners that fit over your mask seal and can be washed separately to help keep the seal effective. Now finally, besides preventing mask leaks, you can try adding moisture directly to your eyes by putting in some eye drops before you go to sleep. The thicker ones, such as the gel-based ones, are better for this. Last up, claustrophobia. Claustrophobia refers to the irrational fear of enclosed spaces. This one tends to affect those that are new to CPAP therapy, and it can be common among new users. Some feel anxious when wearing their masks and can even suffer from panic attacks. The solution here is to get used to wearing the mask and the sensation of the air pressure and to overcome your fear of it. The best way to do this is to wear the mask with applied air pressure during the day. Maybe take 10 to 20 minutes at a time to wear the mask while doing something relaxing like watching TV. As you repeat this process, you should slowly become more accustomed to the therapy and be able to overcome the claustrophobia you feel at nighttime. Also, it's important to make sure you have a mask and headgear that fits well for you, as poor fitting masks and headgear is the leading cause of claustrophobia in users. So that's an explanation of the causes and solutions to some of the more common side effects of CPAP therapy. But if you are experiencing ongoing problems like the ones we've discussed, or other problems we didn't talk about, then please do give us a call. We'd love to have a chat with you and see if we can help. At Respshop.com, we have many highly qualified people ready to help give you the most relevant information and advice, and there really is nothing like the personal touch when navigating the world of CPAP and apnea therapy. We have some great info on our website, Respshop.com, and our phone number is there as well. And remember to like this video and subscribe to keep up to date with all the CPAP info we put out on this YouTube channel. So until next time, friends, sleep tight.